Good morning. My name is Hannah Cabe. I'm a rising second-year medical student at Mercer School of Medicine. This morning, I have the privilege of introducing our next speaker. Dr. Jennifer Holton is an assistant professor in the Department of Psychiatry and Behavioral Sciences at Emory University School of Medicine and is the director for Emory's Child and Adolescent Psychiatry Fellowship Program, as well as the medical director for their psychiatry clinic. Dr. Holton received her Bachelor of Science from Emory University and completed medical school at the Parental School of Medicine at the University of Pennsylvania. She completed her general psychiatry residency and child and adolescent psychiatry fellowship at Duke University School of Medicine, where she served on faculty before returning to Emory. Dr. Holton's clinical work primarily focuses on the treatment of ADHD, anxiety, and mood disorders in children, adolescents, and young adults. She also enjoys teaching and supervising students, residents, and fellows, and engaging in advocacy and educational efforts on behalf of students, residents, on behalf of patients and the mental health profession. Having grown up in Central Georgia, Dr. Holton is particularly interested in expanding access to high-quality mental health care to youth throughout the state. Dr. Holton is the president-elect of the Georgia Psychiatric Physicians Association and chair of the GPPA Women's Committee. She also currently serves as the secretary-treasurer for the Georgia Council for Child and Adolescent Psychiatry. She is a distinguished fellow of the American Psychiatric Association and is a member of the American Academy of Child and Adolescent Psychiatry, the American Association of Directors of Psychiatric Residency Training, the Association of American Medical Colleges Group on Women in Medicine and Science, and the Medical Association of Georgia. So please join me in welcoming Dr. Jennifer Holton.
Thank you so much. I'm a shorty, so I'm going to pull this down. Can you guys hear me okay? Okay. Let me make sure I know how this works. Okay, perfect. Oh, interesting. Okay. So my slides, it looks like, are doing a little bit of a weird thing, so we'll see how this goes. But I'm excited to be here with you guys today to talk about supporting healthy adolescent development, particularly when we're thinking about the development of adolescent girls who, may at some point become mothers. So how we can intervene at this stage of development to really have a positive impact on not only their growth and development, but the development of their future offspring. I don't have any conflicts of interest, and this talk is worth one continuing education credit. So we're going to talk a little bit about a kind of brief overarching overview of adolescent development within the various developmental domains. We'll then talk a little bit about a couple of protective factors in supporting healthy adolescent development, in particular parental monitoring and a sense of connectedness, and how those can be, as Dr. Tarbutton was talking about, a buffer, right? They can help really sort of improve outcomes for adolescents. We'll then talk a little bit more specifically about mental health trends, substance use, and sexual health in adolescents, and then we'll have a little bit of time at the end for some reflection and discussion. I know we're kind of a diverse group in terms of what we do in our careers, and so I'm excited to hear about your experiences as well and get your input. I hope by the end of the talk you'll be able to recall the importance of parental monitoring and connectedness in supporting healthy adolescent development, be able to describe the overarching mental health trends for adolescents and the need for adequate mental health supports for youth, be able to list 2 areas of improvement in the support of sexual health in adolescents, and be able to identify at least one area that needs to be more adequately addressed within your own field of work to support healthy adolescent development. So we'll start with kind of a brief overview of adolescent development. And we'll start with the domain of physical development. So in terms of physical development, right, we all know that during the adolescent period, this is when youth are experiencing changes of puberty, right? So not only hormonal changes, but a lot of physical changes that are occurring during this period. So how do we support healthy physical development? And a lot of these things will build on what Dr. Tarbutton was talking about in her talk, right, with children. But we know that adolescence is a period of sort of moving out of our family units, right? So they're starting to explore the world outside of their families more, becoming more independent, more autonomous. And this is a really great time to help them develop healthy habits, right, that can stick with them for the rest of their lives. So whatever's going on in their family unit, right, they're learning those habits from their family in terms of modeling, whatever's going on in their family. But we can also intervene to help them sort of start to develop their own habits independent of what they may be exposed to at home. So just like in childhood, it's really important to focus on appropriate nutrition, right? So healthy nutrition, making sure that they're getting enough food and that they're getting healthy foods. When we look at data in terms of food insecurity, this is from 2021. So let's see if this, yeah, okay. So when we look at US households with youth under age 18, in 2021, 12.5% of US households experienced food insecurity at some point during the year. And when we look at, more specifically, households with a single mom, those rates doubled to about 25%. There are also differences based on race and ethnicity, with Black and Hispanic households being more severely impacted by food insecurity than white households. So this is an area, right, where we certainly have some work to do. And schools are a place, right, where children are often provided with nutrition. So when we're talking about 2021, also, right, some of these people, it depends on kind of the state of the pandemic, and kind of what schools were doing at the time in those particular states. But that could have also influenced some of these numbers. Dr. Tarbutton also talked about obesity, and unfortunately about 20% of our adolescents sort of fall into that category, right? So there's a lot that we can do in terms of better addressing appropriate nutrition as well as physical activity, right? So this is a time when they can really start to develop some good physical activity habits. When we look at data, a lot of the data that I'm going to be talking about in this talk comes from the CDC Youth Risk Behavior Survey. So that's a survey that the CDC does of high school students across the United States. The most recent data we have is from 2021, and they surveyed over 17,000 high school students. It's great data to look at. The caveat to that is, depending on what kind of setting you practice in, it does not include anybody who was not in high school. So if you've got somebody who's incarcerated or they've dropped out, they would not be included in this data, right? So there are some caveats to the usefulness of the data, but I think on the whole, it's a good representative sample. What we find in that survey is that 22% of adolescents weren't even physically active for at least an hour a week. That's not great. Most people were, right? But 22% not even active for an hour a week. 67% weren't physically active for at least an hour a day, 5 days a week. And this is, right, again, with physical activity, this is a place where schools can be really important, right? Adolescents are at school. They have the opportunity to engage in physical activity there if we're providing them with those opportunities. But when we look at the data, 53% didn't attend PE at all, physical education classes at all. And 74% didn't attend physical education classes daily, right? So there's some area for improvement there as well in terms of helping adolescents develop this habit of daily physical activity. Adequate sleep, okay? So we know for not just teenagers, but for everybody, and adequate sleep is incredibly important across the developmental domains. When we're talking about these issues of nutrition, physical activity, and sleep, right, this not only impacts physical development, but social, emotional, and cognitive development as well. So these are, right, basics that however we're interacting with adolescents, these are important things for us to be talking with them about. This data is from that same survey, the Youth Risk Behavior Survey, but this is actually data for adolescent females in Georgia. And so 80% reported not getting at least 8 hours of sleep on most nights. Not great, right? There are lots of things that can be factoring into this, right? If you work with teenagers, sometimes they're up doing schoolwork, but often, right, they're up doing other things, including doing a lot of stuff on their devices, right? And so this can really negatively impact their sleep. Teenagers typically have a phase shift delay in their sleep, right? They are wired to want to go to sleep later, to wake up later, School doesn't really allow for that, right? We're still asking them to get up early. So their bodies are wanting to do that naturally, and then they're wanting to be on their devices. So this is another area, when Dr. Tarbutton was talking about limiting screen time, we'll talk more about this in a minute, but I think it's an incredibly important thing to continue to have conversations about, but it's an area where I think many of us who work with teenagers struggle to have them make adjustments in this part of their lives. We talked about the physical changes that are going on in terms of puberty, right? And sometimes during that process, girls can certainly become self-conscious about their bodies. They can have concerns about, is what I'm experiencing normal? And so really sort of helping them understand, yes, what you're going through is normal, and really encouraging a positive body image at this phase of life can be very important, especially when we're thinking about trying to prevent future eating disorders and things like that. Obviously, avoiding substances is important, and we'll get into that a little bit later. Safe driving. So this wasn't something that immediately came to mind to me. I don't really have conversations with my patients about safe driving. But when I saw this data, I thought, maybe I should start talking to them about this. This is interesting. So when we look at, again, female adolescents in Georgia, despite the fact that we have a law now about, texting and driving, 30% reported texting or emailing while driving, concerning. And 43% reported not always wearing a seatbelt. That actually really surprised me because I honestly thought everybody wore a seatbelt now, but not. So I think, this piece of data is important, right? We need to be having these conversations with adolescents. Perhaps even more concerning are the numbers of people who are engaging in driving while intoxicated or riding with others who have been drinking. So 4% of adolescent females in Georgia reported driving after drinking alcohol, and 15% reported riding with somebody who had been drinking. So again, I think important things to continue to talk with our adolescent patients about. We already talked about this, but limiting screen time is also important. I am not a person who says you should not be on screens at all. That's not it. But when we look at data, again, for female teens in Georgia, 80% reported spending 3 or more hours a day on screen time, and this is in addition to whatever amount of time they were spending on screens for school. So if they were doing stuff on screens at school or at home related to school, that didn't count. This is the in addition time. And so, maybe some people are on their device and on their screen while they're riding their bike or they're on their treadmill. That's not the experience that I have with most people, right? Most of them are more sedentary during this screen time. And so that's a lot of time that we're missing out on the ability to engage in physical activity, to engage in sports, other activities, pro-social activities that might really sort of improve their developmental trajectory. So I think, again, sort of thinking about this and having these conversations is important, especially, right, when we're also having these conversations about sleep and trying to get devices turned off earlier, though I don't know about you, that is a tricky thing to get teens to agree to. So moving on to cognitive development, I think the videos that we saw were really great, and so I don't feel like I need to spend as much time here. But what I will say is that brain development, right, is continuing in this adolescent period. What's happening more during this phase is that we're seeing more of that pruning process, right, getting rid of the synapses that we don't need. And we're seeing development of more connections between the subcortical regions of the brain and the cortical regions of the brain. And in particular, the frontal cortex is that last part of the brain to really develop, and that's going on into your 20s. The idea there, right, is that those frontal regions are the things that are responsible for executive functioning, for impulse control. And so while we're seeing a lot of, enhanced cognitive abilities in this age group, with more ability to engage in abstract thinking, advanced reasoning, more ability to reflect, to think about thinking, so metacognition, there's a lot of really cool stuff, right? You can have these really neat conversations with teenagers. But their brains are still not fully there, right? The frontal lobes just aren't quite there yet. And so they can still struggle some with impulse control. Risk-taking is incredibly prevalent in this age group, right? And that doesn't necessarily mean negative risk taking, right? Sometimes when we hear risk taking, we think, oh, all the scary things that teenagers do. But risk taking can also be a positive thing, right? So things like engaging in new activities, learning new things, that can actually be a positive thing. Decisions in this age group, right, despite the fact that they have these advanced reasoning skills that are developing, can still sometimes really be influenced more by emotions and social rewards than logic. So how can we support healthy cognitive development? We really want to support skills for independent reasoning and decision making. And the idea here is that instead of telling a teenager what to do, I don't know about you, but if you've ever tried that, it generally does not go that well. Instead of telling them what to do, we really want to step back and engage them in a conversation, right? Ask them questions to help them think through what all the different options they have in making this decision might be, right? I have option A, B, C, D, and E. And with each of those options, then what are both the short-term and the long-term negative and positive consequences, potential consequences for each of those options, right? So I'm not telling you what decision to make, but I'm helping you think through it and then helping you make a decision based on this data that you are able to generate, right? This is really teaching them those skills and strategies for how to do this throughout adolescence and their adult lives. And we really want to remind them too, right, that making important decisions is not something that we want to do when we're emotionally elevated, right? If we're super stressed, we're super upset, angry, distressed, that's not a time when we want to be making really important decisions, right? We want to do this in a calm state where we can really sort of mindfully think through all our different options and how we want to proceed. And I think this is important for helping them not only think about kind of long-term kind of decisions, right? But it's helpful in all decisions and helping them kind of think through in advance about potential risk-taking situations that they'll be faced with, right? So I'm going to be at a party, right? There's going to be drinking. There might be other substances. How am I going to handle that? What am I going to do, right? So helping them have these conversations and helping them think through these things in advance. It's also really important to get them involved in activities that allow them to take healthy risks. So that's the idea of, right, learning a new sport, learning a new instrument, engaging in something where you have to get up in front of a group and speak, right? Any of these kinds of things that enable them to take healthy risks and that allow them to take on leadership roles, right, where they can use cognitive skills of planning, organization, and they can have these opportunities to lead. We talked about the importance of sleep, right? We know that that's important for brain development as well. Avoiding substances, right? Those can certainly be toxic to the brain. That's, something that we would like to avoid, particularly in this phase of development. We'll talk a little bit more about that in a later part of the talk, but I think this piece is really key, right? Substances in this phase of brain development can be quite toxic to the brain. We know, right, that traumatic brain injury is also something that we want to avoid at all stages of development. In this group, we know that they're apparently not that great at wearing their seatbelt, so that's an easy one, right, if we can get them to do that. Helmets, things like that, right? Anything that we can do to prevent injury to their developing brains. And then we also know, right, that mental health concerns and learning disorders can make it more challenging for them to engage in school and to have academic success. So really addressing those when they're at play and providing educational supports when they're needed. So switching gears to emotional development, right, in this stage of development, we expect adolescents to be able to more adequately identify their emotions, right? Be able to understand what they're feeling, why they might be feeling that way, to be able to put that into words and express it verbally. And this is when they're really sort of gaining even more ability to regulate their emotions, right? That's not always the case in adolescence, right? Sometimes there is a lot of emotion dysregulation in this phase. But certainly this is when they're really starting to develop more skills to be able to regulate. It's also a time when they're trying to figure out who they are, right? who am I? What do I believe? What do I think? Independent of what my family believes and thinks. And so I think that's an important part of what's going on as well. During that phase, they're comparing themselves a lot to other people, right? There's a lot of questioning, a lot of experimentation. And in that process, they're really sort of figuring out how they feel about themselves, and their self-esteem and how they feel about themselves can impact their self-worth. And it can be influenced a lot by approval from family and friends. So this is a lot of what's going on during this phase of emotional development. We also know that unfortunately during this phase of development, there are increased rates of certain psychiatric disorders, particularly for those who have experienced adverse childhood experiences or traumatic events. So we see increased rates of depression, anxiety, eating disorders, substance use disorders, and for those later adolescent years and kind of transitional age youth or young adults, the emergence of more psychotic disorders and bipolar disorder. So what can we do to support healthy emotional development? We don't just generally come to life knowing how to talk about our feelings, and some of us didn't necessarily grow up in families where that happens a lot either. So sometimes we really have to teach, right? Teach them how to identify what they're feeling, teach them how to express what they're feeling effectively, right, in a way that can get their needs met. Helping promote stress management and emotion regulation skills. So this is a critical part of supporting emotional development in this stage. So again, like with all the other developmental domains, getting enough adequate sleep, nutrition, and physical activity is important, right? If we are tired, we are not able to regulate our emotions as effectively. If we are not getting appropriate nutrition, we can be hangry, or we don't have the building blocks to build serotonin and the other neurotransmitters that we need, right? So that's key. It's also really important to encourage engagement in enjoyable and meaningful activities when we're thinking about supporting mental wellness, right? And this is an opportunity for adolescents to really not only develop a sense of self, right? What's important to me, what makes me feel kind of a valuable, meaningful part of society, but it also, right, it can provide a lot of joy, satisfaction, and self-worth. Maintaining positive social supports is really important for emotional wellness in this across the lifespan, right? And then teaching them relaxation strategies, right, that can help them calm themselves, that can help them regulate their emotions better. So these include things like diaphragmatic breathing, progressive muscle relaxation, body scans, mindfulness and self-soothing skills. And all these things can be particularly helpful for regulating stress and managing stress. We always want to be mindful, right, of monitoring for warning signs. So the idea here really is that, things like, how are they doing academically, right? Are we seeing declines in their academic functioning? Are we seeing changes in their social functioning? Certainly, if they're expressing any thoughts of not wanting to be alive or engaging in self-harm behaviors, right? We want to be looking for those things early and intervening early and really getting them connected to appropriate services. So moving on to social development, right? During the adolescent phase, there's an enhanced ability to form and maintain relationships. We've talked about how, right, teenagers are sort of moving out of their family units more. That's not that family's not important still, it's still incredibly important. But, right, they are kind of developing more autonomy, more independence, more self-sufficiency. And in the process of moving out, and engaging in the world more, they're really expanding their social networks. And they're focusing more on peer relationships and romantic relationships as well. So how do we support healthy social development? Right, here we really want to model healthy relationships, appropriate boundaries, and that includes not only having our own appropriate boundaries, but also respecting boundaries of other people. We want to model empathy, concern, and respect for other people, encourage open, respectful, calm communication with other people, even when we're having disagreements, right? And especially when it comes to issues of safety. So the idea here is, right, we want parents to engage their youth, their teenagers, and let them know I want you to call me. I want you to talk to me about sensitive topics. I want you to call me, if you're out at a party and there's drinking, instead of you driving home because you're afraid you're going to get in trouble, or getting in the car with somebody because you need to get home and you don't want to get in trouble for being at this party where they're drinking. I want you to call me instead, right? And I'll come get you. You're not going to be in trouble, right? I want you to be safe, right? So having this open communication where youth understand that they're not going to be judged and they're not going to get in trouble for reaching out when they need help. Supporting engagement in positive peer groups and pro-social activities. This is incredibly important, right? This concept of having these positive peer groups where you can really practice social skills, develop these social skills. This piece is really important for decreasing unhealthy risk-taking behaviors, and improving outcomes in a whole host of areas. It's also really important for parents, for us to talk with parents about monitoring, and we'll talk a little bit more about that in a minute, but it's important for parents to really sort of get to know the friends and the partners of their teenagers, who they're with, what they're doing, where they're going. And I want to take a little brief pause to talk about the impact of social media across these different developmental domains. Sometimes when we think about social media, right, we sort of jump to all the negative things about its use, and certainly there are a lot of potential negative implications of social media use. We already talked about the fact, right, that 80% of teenage girls in Georgia are spending 3 hours or more on screens outside of school time. This is national data. 95% report having access to a smartphone or having a smartphone themselves, and 71% report being on at least one social media platform. So, right, this is something that our youth are highly engaged in. And there can be some positive things with social media use, right? It can be an opportunity for adolescents to seek and receive education, particularly on sensitive topics that they are embarrassed to talk about, right? They can get information from some of these sources. It can also be an area of support for a lot of our youth, right? A lot of positive support. And help them maintain social connection. So that part can be a really positive part of social media use. And when they are experiencing positive reactions to their involvement on social media, those youth experience higher self-esteem and satisfaction with life. So all that's good. For our public health folks in the group today, right? Social media can also be something that we can utilize to promote health and wellness, right? So this could be something that over time we could really sort of use to our benefit to help improve wellness in this age group. Unfortunately, there are potential negative impacts though, right? We know that we talked about how adolescence is a time of comparison, right? They're comparing themselves to others, and now they have limitless people to compare themselves to in this really artificial way, right? They're comparing themselves to curated lives that are not real, right? It's sort of these unrealistic, idealized versions of people's lives that they're then constantly comparing themselves to, which can result in lower self-esteem and increased rates of eating disorders and those sorts of things, right? So this is not a great aspect of social media. There's also the chance for misinterpreting communication, right? And that can certainly happen. We all know that can happen in any form of electronic communication, right? And when many of us, those of us who are a little bit older in this group, were growing up, if you were struggling at school, right? If you were having negative social interactions or something was going on at school, when you left, you kind of got to leave it, right? It wasn't in your face constantly, but for adolescents now, they do. They have their devices with them all the time. They're on social media. And so any kind of negative stuff that's going on in their world follows them home, and it's with them 24/7, right? So this can also have negative emotional impacts. Unfortunately, when we look at the data, about 20% of female high school students report being electronically bullied. And so this, again, is another really important piece when we're thinking about social media use, is talking with teenagers about what are you doing online, right? This 3+ hours a day that you're on there, what are you doing? how is it making you feel, right? Is it enhancing your life in some way? Great, let's support those things. Is it negatively impacting your life in some ways? Okay, if so, then what do we want to do differently about those aspects of electronic use and social media use, right? So it's not telling them get off social media. It's more trying to help them think through, what are they engaging in online? Is it making them feel better? Is it improving their lives, or is it making them feel worse? I specifically think about a patient that I worked with who it was having a lot of suicidal thoughts, right? And when we talked about what they were doing online, it was sort of in the state of depression. They went to sources online that just sort of fed into the depressive thoughts, fed into the thoughts of not wanting to be alive. So we had to sort of think about, okay, is this making your life better? No. Okay, what are some things that you engage in online that do make you feel better? All right, how about we shift the balance? Can we spend more time on these things that make you feel better, less time on the things that make you feel bad? And eventually the time as the depression, right, as that happened and the depression got better, there was a lot less time spent on these other parts of social media that made the person feel worse. So, as we talked about the different developmental domains, we talked about things we can do to support healthy development within those domains. But specifically when we're thinking about protective factors, things that can really sort of help support positive growth and development during the adolescent period, I wanted to focus for a few minutes on two: parental monitoring and a sense of connectedness. And these are things that actually now are, as of this last survey with the Youth Risk Behavior Survey, are measured in that survey now as well. When we talk about parental monitoring, they were really sort of trying to understand how many youth experience high parental monitoring. And when we talk about that, we're really saying, do your parents or some adult in your life know where you are, what you're doing, at least, most of the time or all of the time. For people who are kind of familiar with the different types of parenting, right, when we think about authoritative parenting versus authoritarian and passive parenting, the idea here is that this is really that kind of gold standard of authoritative parenting, where there's high warmth, right? There's love and warmth and concern, connection, but there's also monitoring, right? There are clear consequences, there are rules and expectations, right? All that's known and upfront. So this is the parents who are doing the monitoring. And we know that high parental monitoring is associated with decreased sexual risks, decreased rates of substance use, experiences of violence, and suicidal thoughts and behavior, right? So this is an important factor when we're thinking about, trying to intervene in positive ways. And what they found in the Youth Risk Behavior Survey was that actually most adolescents reported experiencing high parental monitoring. And when we're looking at female adolescents in particular, almost 90% reported high parental monitoring. I wonder a little bit about this data, right? Because this is teen self-report. And I don't know about you, but a lot of teens that I work with, will have these thoughts, right, as they're trying to assert their independence. My parents are up in my business, they're so controlling. They want to know what I'm doing, where I'm going. If you had a different way to verify that, I would be interested to know, right, if we could verify from a parental perspective or a more objective standpoint, is this really happening in 90% of kids, that there's this high parental monitoring, or is this more their perception of how much monitoring is going on, right? I want less. So I don't know exactly what to make of this. I mean, on its surface, it looks like we're doing pretty well with this, but I wonder if we're doing quite as well as this makes it look like we're doing. I think when you're working with families, right, sort of reminding parents of the importance of this and how much of an impact it can make is important. Connectedness is another really important protective factor. And this, when we're talking about connectedness, we're talking about a sense of connection to family, to community, so that's peers, other adults in their lives, and school. And we know, right, from multiple studies across the years that a sense of connection is important in promoting positive youth development and protecting against unhealthy risk-taking. We're going to talk specifically about school connectedness because that's what they measured in the Youth Risk Behavior Survey. And that's this idea of feeling among adolescents that people at their school care about them, about their well-being and their success. And this has been shown in studies to be associated with decreased risks related to substance use, mental health, violence, and sexual behavior. So youth who report feeling connected are less likely to use substances, they're less likely to report poor mental health, they're less likely to consider or attempt suicide, to exhibit disruptive or violent behavior, to carry or use a weapon, or to engage in early sexual intercourse. It's also associated with improved academic outcomes. Whoops. Oh no. I don't know what happened, but our slide is missing. So we had another graph about connectedness. Essentially what they found with connectedness is that more male students reported feeling connected than female students. And there were also differences according to race and ethnicity with students who experienced more racism and who were from racial and ethnic minority groups and members of the LGBTQ community, all reporting lower rates of connectedness. So I think, there's room to improve with this. The good news is that there are lots of studies on how to improve a sense of connectedness, particularly when we're talking about school connectedness. And there's information on both the CDC website and the Department of Education website on evidence-based strategies that schools can employ to increase a sense of connectedness. All right. So we're going to sort of switch gears and talk about recent trends in mental health and where we are related to that in adolescents. So we know, right, that poor mental health results in negative outcomes for adolescent health and development. Youth who are feeling hopeless are at increased risk for risk-taking behaviors that can increase their risk for things like HIV, sexually transmitted infections, unintended pregnancy, and it's associated with increased rates of suicide. We talked before a little bit about, right, how the rates of many psychiatric disorders increase in adolescence. I think the one that I want to kind of highlight right now is rates of depression. So prior to puberty, rates of depression in boys and girls are equal, 1-to-1. But once we hit puberty, rates of depression in girls double. And so now we've got rates of depression twice that in our adolescent females versus our adolescent males. And this is really important, right? Because when we think about, certainly over the maternal lifespan, right, earlier episodes of depression often are associated with more episodes of depression, more severe depression over the lifespan. And so we really want to be able to identify this early, intervene early. Obviously, if we can prevent, that's even better. When we look at the data about depression, the Youth Risk Behavior Survey had several questions about this. And so again, if on this chart, we're looking at the orange bar is females, adolescent females in Georgia. The blue is in the United States, females in the United States, and the tan is males in the US. So Georgia females, US males. And they asked about experiencing persistent feelings of sadness and hopelessness, right? So this is a marker for depression. And what they found was that indeed rates of depression in males were about half that of females. So you're talking about almost 60% of adolescent females reporting this persistent feelings of sadness and hopelessness. And y'all, I don't know what has happened with my formatting here, but sorry. We'll sort of talk about the data. These are the current data from 2021, and these are trends, and we'll talk about that as well. So 41% reported experiencing poor mental health. This data about suicide, I think, is incredibly important to kind of be aware of and be mindful of. So when we're talking about seriously considering suicide, 40% of adolescent females in Georgia reported seriously considering suicide, 33% made a suicide plan, and 22% attempted suicide. And what you'll see here is that there's a difference, right? In Georgia, we're doing worse on these than the national average, which is concerning, right? And says to me, like, not only do we need to be doing more in terms of sort of assessing for these things, but we also need to be doing more in terms of, prevention and early intervention. And I know some of you in the room are doing those types of programs. When we look at the data over time, right, the Youth Risk Behavior Survey has 10-year data comparisons, so you can look back over time. And on any of the markers that we have this 10-year data for, rates were worsening over time, right? So that's also concerning. We're not moving in a positive direction. Things are getting worse. So again, right, there's a lot of room for improvement in terms of enhanced programs for prevention, for screening, for early intervention, and for treatment of mental health concerns in adolescents. When we look at substance use, right, we know that this is a time when, again, adolescents are experimenting. We know that early use of substances is a risk factor for the development of substance use disorders. We also know that substance use is associated with a variety of negative risk behaviors, so associated with sexual risk behavior, experiencing violence and mental health problems. And, right, if by some chance our adolescent females get pregnant while they are using substances, then we run the risk of negative long-term consequences for their offspring having been exposed to substances during the pregnancy. This is national data. The good news here is, at least with many of these substance use issues, we're doing better over the last 10 years, so that's great. This is national data, so when we look at drinking alcohol, using marijuana, using illicit drugs, and misusing prescription opioids, we're actually seeing some improvements over the last 10 years, so that's great news. It's a little bit harder to know what to make of this electronic vaping, right? This data has kind of been up and down, and this was during the pandemic, so it's also a little unclear if you're spending more time at home, or you may be less likely to be engaged in this than if you're at school, because the year before we were increased, right? So when we bore down on this data and look specifically at adolescent females in Georgia, right, who we're concerned about, we're doing pretty well in terms of cigarette smoking. That's great news, right? Only 1.5% are currently smoking cigarettes. But when we talk about electronic vaping products, right, we're not doing as well. So about 40% report ever using electronic vaping products, 22% currently using, and 5% using daily. And we know, right, the risks for nicotine on developing babies as well, right? So not ideal. And we know, right, that this is really hard. Nicotine addiction is really hard for adolescents, like for adults as well, right? This is something that's not easy to treat. And when we're talking about the content of nicotine in these electronic vaping products, right, it's pretty intense. When we look at alcohol, 29%, so almost 30% report currently drinking alcohol, and 17% report currently binge drinking. So again, right, for our adolescent females who are drinking, right, they're going to be more at risk for sex practices that could put them more at risk for sexually transmitted infections, for unintended pregnancies, right? They could be, at risk for injury or death due to, motor vehicle accidents, that sort of thing. And if they get pregnant, right, and they're using alcohol during the pregnancy, then this is going to be putting their offspring at higher risk for things like fetal alcohol spectrum disorders, which have lifetime negative consequences. When we look at marijuana use, 32% report ever using marijuana and 18% currently using marijuana. We talked about, right, this concept of the adolescent phase of brain development as being this important window during which we want to try to limit exposures. And this is one one of the really important areas, right? Because a lot of youth I work with are like, oh, marijuana's not that big of a deal. But what we know, particularly for any youth who have any family history of psychosis, is that this is a window during which, right, in brain development, that we really want them to avoid marijuana use. I'm much more likely to be like, you're in your mid-20s or 30s now, okay, but I've gotten you through that critical window of brain development. Particularly for those who have a family history, you want to be really sort of careful with this, right? We know that marijuana that our youth have access to now is certainly much more potent, and so we want to be kind of mindful of that. 23% reported ever misusing prescription pain medication, and this is one where we're actually doing worse than the national average, which was 15%. And 15% report ever using illicit drugs. So again, right, with substance use as well, we have room for continued and enhanced programs for prevention, early intervention, and treatment of substance use in adolescents. In terms of sexual health, we know, right, that in many domains with regards to sexual health, we're actually doing better in adolescents than we have been in the past, but we're still not doing great. So there's still definitely room for improvement. When we look at data from 2020 in terms of sexually transmitted infections, adolescents accounted for 20% of the new HIV diagnoses in the US in 2020, and over 50% of the nearly 20 million new sexually transmitted diseases reported that year. When we look at pregnancy and birth rates, those for adolescents are currently at their lowest recorded levels, which is great news. But despite that, in 2021, still over 145,000 infants were born to adolescent females. So that's a lot of babies. And we know that racial and ethnic disparities still persist here as well, with rates for Hispanic and Black adolescents being higher than those for white adolescents. So there's certainly room for improvement. When we look at rates of sexual activity, this is good news, right? That over the last 10 years, the number of female students who ever had sex has declined, as has the number of female students who are currently sexually active, and the number who have had sex with 4 or more partners in their lifetime, right? So more partners, potentially putting them at more risks for sexually transmitted infections. So this is good news, right? This is a positive thing. Where we're not doing so well is that when we look at the use of methods to prevent unintended pregnancy and to prevent sexually transmitted infections. And so this is, again, data from the Youth Risk Behavior Survey. And when we look at, they were asked, these adolescent females were asked, did you use a condom the last time you had sex? So 53% said no, only 47% used a condom the last time they had sex. We're doing even worse with hormonal birth control, only 37% are using it. And when we look at dual protection methods, right, so the idea is here we're using a condom and hormonal birth control, hopefully to give us the best chance at preventing unintended pregnancy and STDs, only 11% are using dual protection. So certainly room for improvement there. We're also not doing super great when it comes to testing for sexually transmitted infections, including HIV. The percent who reported having ever been tested for HIV was 6%, and that was down. If you look here, this is the line for females over the last 10 years. So we're doing worse in terms of our testing for HIV as well as for other sexually transmitted infections. So again, this is the decline for females. So something for us to kind of think about, right, is that there are probably a lot of different ways that we can improve sexual health in adolescents, but based on this data, in particular, right, we certainly have room for improvement in terms of our rates of testing for sexually transmitted infections and for improving the rates of use of dual protection methods among adolescents. So I wanted to take just a second just 1 minute for people to kind of think to yourselves about one area that you feel like could be more adequately addressed within your own field of work to support healthy adolescent development. And maybe you feel like, oh, within my area of work, there's not anything relevant. Maybe there's something that's relevant to some organization that you're involved in terms of your life outside of work or your own family. But just to kind of take a minute and think about that, right? We've talked about these different developmental domains in terms of physical, cognitive, social, and emotional development, and different ways that we can support healthy development within those different domains. We talked about protective factors like parental monitoring and a sense of connectedness. And then we talked about trends, right, in mental health, substance use, and sexual health in adolescents, and ways that we can intervene there. And I just want to encourage people to take a little bit of time to think about things that you feel like are relevant within your own field of work, because I know we're all kind of doing different things in the room. And that's really it for me. So I'm happy to also engage in discussion and questions that people might have.
Good morning. My name is Michaela Walker, and I'm the CEO and founder of Postpartum Warriors. I actually have a few questions for you because I focus on newly postpartum moms, and some of the moms in my community have teenagers, and so I have a few questions. Besides monitoring screen time, what do you think can contribute to a healthy balance of social media use? And do you believe that there should be a certain age that parents allow their children to use social media?
Yeah, so in terms of, so there's the time issue, right, with screen time, and then there's what they're doing while they're on the screens. And so I think that's the other piece that I would encourage people to think about, is not just how much time, but what are you doing with that time, right? Because some of that could be helpful, right? It could be good. But you want to make sure that you're really sort of thinking through how are they spending the time. In terms of age of use, oh, that's a tough question. I'm sure there's probably data out there. I would say certainly, and you can chime in on this if you'd like, I try to avoid social media use for younger children, and I really try to push it as far as we can. There starts to become a point, right, where it's a risk-benefit kind of discussion that I have with people, right? Because sometimes the fact that a child is not engaged in certain online activities can become a negative for them in terms of their social interactions with peers, right? And they're being left out, ostracized, excluded, and unable to engage with their peers because they don't have these similar experiences. So it can sometimes become this conversation about risks and benefits and trying to figure out how to do this in a way that is going to be a positive thing and not a negative thing.
I think the data supports that the social media should start by 15. In the adolescent brain, it's a much higher risk. And 15 is not an absolute, but it's the best time if a child is going to start social media.
My next question, you mentioned that before puberty, the rate for depression and anxiety is 1-to-1, but after that, it doubles for females. Besides hormonal changes, what do you feel is contributing to that?
Yeah, so there are some interesting studies about that. I think when you look at the data, probably the hormonal changes have the biggest impact, honestly, in terms of that differentiation that's occurring. That's not to say that there aren't also a lot of environmental things that are going on around that stage as well, right? But there have been some studies that looked at sort of trying to separate out all those different components, and it seems like probably the hormone changes are the largest contributor. And I think somebody's talking about menopause, right? In that same way that we see sort of shifts in that menopausal transition with mental health.
Hi,
I'm Joanne Chopak Foss from the Jinping Sioux College of Public Health at Georgia Southern. So, as many, I'm sure in this room know, there is a mental health provider shortage in our state. And specifically with respect to pediatric/adolescent psychology, psychiatric help providers. So what are some of your thoughts, and maybe of your colleagues, anybody else in the room, of how we can best meet these shortages with potentially non-MD providers, mid-level providers? If you could maybe address that.
Yes. So there may be other, so I will preface my answer with, I am not a public health person. I am a clinician who provides, direct patient care. So there may be some of you in the room who can answer this question better than me, right? Because this is not an area that I really study. I will say, however, that yes, you're absolutely right, that we've got to do something different because there aren't enough of us. So, I have at times heard this idea of, some care is better than no care, and I would say that's actually not true when it comes to mental health. That sometimes, right, people in trying to do good and help kids can end up putting children on a lot of really heavy-duty medications that actually can cause harm long-term. And so I think we want to be careful and conservative in our medication use in this age group, right? There's a lot of brain development that's still going on. So there's, right, we want to make sure that the people who are providing care have appropriate training and appropriate supervision, right? When they get to a place where they really don't know what to do, that they have access to somebody who perhaps has more training and knowledge and can then assist. So I think there's a lot that can be done in terms of consultative models, right? For people being able to practice within their scope, right? Knowing what you know and where you need help, and then being able to access that help when you need it, right? So I think, there are lots of projects that are going on around the state to try to enhance training for pediatricians, for nurse practitioners on these mental health related topics. And I think that work is incredibly important. And then making sure that when they need help, they can get access to specialty providers who can then kind of consult and help them on those more challenging cases. Did you want to?
I've been on a roll lately about licensure. I think that we train really good marriage and family therapists here. I know the schools across the state. We have licensed professional counselors. We have psychologists who really serve an important role in the mental health system. But they come out of a good program and they're given an associate license for 2 years. And often they have to get mentoring. I'm not opposed to that. I think that's appropriate. But insurance companies won't pay them with an associate license, which is insane. So somehow we have to get them a full license and require the mentoring. I don't have problems with that, but get them a full license. They've been in school forever. I mean, I can walk out and deliver a baby. That ought to scare somebody without mentoring. But truthfully, we have educated people who are very capable and serve a huge need, and we have bureaucracy that prevents them from getting to the workforce. And so we have to look at that. I don't think the answer, I'm a big believer in telehealth. I do not think the answer is for-profit counseling services on TV. I think that's dangerous. I don't think they have an emergency plan. I think that's something we should shy away from. And I also don't think the answer is universal licensure, because there's so many pitfalls to that. It's not, but I think we have to disrupt the turf battles and the protective parts of licensure that are not helpful to our state. Because the Innovation Center in the school, we travel everywhere in the state. And you can go into any county, even without a physician at all. The first thing people ask for is mental health services. And it is desperately needed. So I don't have an answer, but we need a workforce to get on that.
Good morning again, everybody. My name is Xavier Battle. I work at the Department Veteran Affairs, going on 5 years now, and I actually specialize in helping people in, it's the acronym stands for CBOC, Community-Based Outpatient Clinic. So I help go through Athens, Georgia, Statesboro, Georgia, on Georgia Southern, people who, we cater towards veterans, so I completely understand from the mental health perspective, and I'll tie in for the adolescents as well. But one thing that we do use as well, we use support groups. So in Athens, like I think either once a week or a couple of weeks, they get a whole bunch of veterans, and they send them outside when there's some nice weather, and they sit down, they talk about what's going on with their day or something that's on their mind. And granted, yes, there is a shortage, and granted, it is a demand for mental health providers, but doing things such as, like at the hospital, we have workouts or yoga or things to where people feel more tied into the community, that helps them a lot, and I see them change. And when I was doing scheduling, because in Augusta, Georgia, for their VA, we're under Visit 7. So for the CBOCs, we cover Aiken, South Carolina, Athens, Georgia, Statesboro, Georgia. So I used to schedule for 2 different states and 3 different places. Telework, the best way I can explain is telework is like turkey bacon, and I'm just being honest, and then a real provider is like pork bacon. We know that turkey bacon is okay, but sometimes it's better to have a real interaction. And I will also, just to preview on just the substance abuse in regards to adolescents. This February, I had a wonderful privilege to go out the country to Europe, and trying to be professional as possible. In France, their drinking age is way lower, and I can guarantee you, early in the morning they're drinking as well as they're smoking cigarettes. In the Netherlands, where just marijuana is just legal throughout the whole country, you have people just openly just smoking J's outside. But one thing I do notice from just a social health perspective, there is no homeless people walking around the streets like that. And I was able to go to Germany, France, United Kingdom, and Belgium. Moral of the story is, though I wholeheartedly agree that having substance abuse and not having protected sex is going to raise those roots, I think more specifically in the state of Georgia, we need more programs, to, especially with the young ladies, to have like just a safe place where they can talk. That they're all going through the same situations. Some people might be going through some of the others, but if we can find a way to supplement what's going on and provide an environment to where you might have a hard time at school, but you have a safe place somewhere here on the weekends or so, we can really monitor that change. Even at Mercer, we can possibly take the initiative and start that there, because I don't really think any universities in just the Georgia area is taking the initiative, especially for young ladies, because without the growth of our ladies, we won't have no country. So I'm just saying that.
Yeah, I think you're hitting on some really important things, and I love how you're talking about that sense of peer support and connection, right? And we know that sense of connectedness is really important in terms of supporting healthy adolescent development. And so I think your idea of, like the support groups that you have for veterans, yes, that peer support among adolescents is incredibly helpful and important. So thanks for really highlighting that too.
Good morning. My name is Luella Rose, and I'm from Columbus, Georgia, and I am to respond to your comment of finding support for young girls. So I represent Columbus Wellness Center Outreach Prevention Project, a nonprofit organization since the early 90s, when we started working with women who were newly diagnosed with HIV, and we were sent home to die in those days. We are actually starting a program with our young girls, our Swagger Lakes Black Joy Girl program, and where we are encouraging our parents that our girls need us and we need them. We are asking you to do the sacrifice, because we can't wait on the local, state, and federal government. So far we have been very successful by putting that plea out that we need you, and we provide different speakers along the way, as well as stress-related factors to help them doing that. And we do believe in decreasing the device that they be on. So we're trying to take a grassroots approach because, and we try to limit our financial output by utilizing what is provided free. The library, the beautiful skies, the playground, simple things to let them know that we care. That way they have that connection with a trusted adult. So it's out here, but we are pleading to our mothers, our grandmothers that we call our George GMs, general managers, that we are the ones that we can do this. We have to make the sacrifice, not allow them to make the sacrifice. Thank you.
That's great. That's really, really wonderful work that you're doing. Thanks for sharing. Yes.
I think, also, I think to reach the people who need help for mental health problems, one thing we have to do is we have to meet them where they are. And for the young adolescents, it is best, like he said, if you can go in and see that counselor and stuff. But I have pregnant women, grown, and teenagers. They had a lot of mental issues going on, as you know, right? Moms, and even after they deliver, before they deliver. So in our program, I have to give it to the federal government. We give them that data. In a year, they saw that big number. So we told them one of the problems was we had Medicaid, and you could do Georgia Hope, but when I'm calling them back, it's taking 3 weeks to 4 weeks for them to get an appointment. They were doing the best they could with what they had. They even started a support group. We have one every Tuesday, but when we weren't coming on, so the government, government did a program where they have a 24/7 hotline for phone calls or texts. And my women usually will opt to take that, even though I try to offer them both of them. I find that they will do that one where they can phone or text. So it's not the best, but that is what the young people use.
Yeah.
That texting.
You're absolutely right, right? And even the Georgia Crisis and Access line has a text line now, right? So I think you're right, that age group sometimes feels better using that type of communication than face-to-face. It's a mixed bag. I think there certainly is a role for telehealth and for those kinds of text-based interventions as well. Sorry, you had a question or a comment?
Good morning. My question is related to nutrition in adolescents. So as adolescents spend more time away from home with their peer groups and they're making maybe different nutrition choices than a home-based meal. And so what is the best approach to sort of continue building a foundation of good nutrition without creating an issue around food or getting into food battles?
Yeah, so I think that's an incredibly important question and is probably fairly complex. But I think one thing that I'll say is, right, when we're thinking about nutrition, when we're thinking about exercise, when we're thinking about, issues with weight in this age group, I don't talk about weight, right, with my adolescent patients. What we talk about are healthy habits, right, forming healthy habits. And we're not looking at a number on a scale, right? We're not looking at calories that they're consuming. We're not looking at exactly what they're eating, right? I don't really want them monitoring in an intense way what they're consuming, because that can sometimes start to eating disordered behavior, right? So we're talking about making healthy choices, right? Like, you're gonna be out and about. What are some healthy things that you might be able to choose? The concept of moderation, right? Like, it's not that they always have to make a healthy choice, but we want more of those choices to be healthy choices. So I think it's a challenging thing, right? When youth are out and you're not able to really sort of provide food for them, but they're going to be on their own soon anyway, right? They're going to be at college. So these are times when you can really sort of start to let them explore a little bit, right? You set those foundations earlier in those early childhood and childhood years, so that by the time that they are teenagers and they're kind of out and about more and they're making these decisions on their own, that hopefully that foundation has kind of been laid. It's not that too, like, right, I mean, we can see sort of shifts over time where they might be making healthier choices at one point, less healthy choices at another, but then things might revert again, right? So it's sort of this ebb and flow concept as well, right? And not getting too sort of focused on any one particular thing, but just in general, sort of this idea of how can we make healthy choices, right? What are we doing for our nutrition? Are we making sure we're getting enough fruits and vegetables and whole grains? Are we making sure that we're getting enough exercise? That sort of thing. And with exercise as well, right? Sort of, again, that hopefully, like for a lot of young people, if that can be something that's pro-social, right? Where they're engaged with other people, that's even better, right? Because they were sort of getting double dip from that activity then. Anything else? All right, well, thank you. It was great to be with y'all and to hear about all the things you're doing as well. Okay.